all of us strictly following in months ahead, perhaps current public health guidance. So let me on what fewer people than we at a time and not more than one a day, and keep to a maximum of 8 people in a group. We should all be washing our hands often and thoroughly. If we're not at home, make sure we have hand sanitizer with us. And please wear a face covering if you are in a shop or on public transport or in any enclosed space where physical distancing is more difficult. Avoid touching hard surfaces, clean any that you do touch, and if you have symptoms, get a test immediately and follow the advice on self-isolation. And of course you can book a test by going to the NHS Inform website. If we all continue to do these things and make sure we don't ease up on the basic public health guidance, then we'll continue to see this virus suppressed, and we will continue to see easing of lockdown restrictions become much more possible in the future. So my thanks again to all of you for doing that. I'm going to hand over now to the Chief Nursing Officer and then to our National Clinical Director to say a few words before taking questions. But I'll hand over first to Fiona McQueen.
First Minister, thank you. Today I want to say a few words to women who are pregnant and have new babies, and to our maternity services. Being pregnant is an incredibly exciting and special and at times worrying time for women and their families. And during the COVID-19 period, it's been particularly challenging and difficult to be able to manage a pregnancy or a new baby without the support of families. But I wanted to emphasise that the maternity services have remained open. They have had to restrict in some areas their normal ways of working, but absolutely normal maternity services have opened and have remained open. Our services, our obstetricians and our midwives have responded in really innovative ways to make sure that routine but essential, because all maternity care is essential, care has been delivered to women throughout this period. We've seen over 250 near me, so remote antenatal consultations, which means that women don't have to leave their home, but they can still have access to the same specialist and expert advice that they need. Similarly, and particularly, but not exclusively, for women who are shielding, we have put in monitoring systems so that they can take their own blood pressure, test their own urine and report back to their healthcare practitioner. And we have had some online antenatal classes, which means that women who are in their pregnancy can try and keep up to date with what's important and answer any of the questions that they may have about their pregnancy and early days of the having a new baby. But it's important that pregnant women remember that maternity services are open and they have not to worry about seeking extra help if they need it out with their normal routine appointments. So if they have any concerns at all, whether it's perhaps reduction in the baby's movement or any worries about their health, then they contact out of our services or in the services, and they will be seen and given advice right away. We also have put in other innovative technological solutions. Sometimes our babies have to go in for special care and interneonatal units, and our midwives across the country have been able to send videos of babies out to families and to loved ones, so that they can reassure them that if they're not managing to be in the unit with them, that they're provided their care and their content and that they're being well looked after. And that has been really warmly received by families all across the country. And as our maternity services continue to provide care, we're looking at how we can restart some of the services that have been paused, such as home births. And all across the country, the maternity services are looking at how we can provide the wide range of services that women enjoy across Scotland. So I want to thank all of the services, whether it's the neonatal services, midwifery services, obstetric services, for managing to support the women across Scotland who have pregnancy, their birth and in the early days of having a new baby. Thank them most sincerely for all of the work that they've been doing in this difficult time, and to look forward to seeing their new and innovative approaches as we start to open up our services.
Thank you, Fiona, and I'll hand over to Professor Leach.
Thank you, First Minister. From the beginning of this pandemic, we've advised and discussed how we will follow the science I wanted to give you just a brief update on some of the research that is helping our understanding of the virus and how we will seek to defeat it. All around the world, the scientific community are working together at an astonishing and unique pace. They are aiming to understand this new virus, how it spreads, who is especially susceptible to it, and this knowledge will continue to help us as we move through our phases here in Scotland. They are working to identify treatments that may be helpful for people who are hospitalised with suspected or confirmed COVID-19, and they are working to develop a vaccine against COVID, which will give us an exit strategy for the pandemic and save lives. This is exciting and fast-paced scientific work, and I wanted to take the opportunity to highlight 3 particular studies. The genomic study is being led by Dr. Kenneth Bailey at the University of Edinburgh. This is exploring the effects that the coronavirus has on patients and identifying why some people have only a very mild infection and yet others may be predisposed to more serious forms of the disease. They've recruited 20,000 patients, and as this study progresses, it should help to identify which treatments have the best chance of success. The recovery study, which is probably the most famous now globally, is comparing a number of different treatments for those with severe symptoms of COVID. It is vital that we find treatment to help patients, but it is equally vital that we quickly find out what does not work. Last Thursday, the recovery trial advised that they had found no clinical benefit from the use of hydroxychloroquine in hospitalised patients with COVID, and they removed it from their advice. This important finding will help to improve care for patients around the world and ensure that we concentrate on treatments that do actually help. And finally, there are a number of different groups working on developing vaccines. The Oxford University Vaccine Group started on the 20th of January this year to seek a vaccine for this disease. They will be recruiting to phase 2-3 studies, which expands the age range of patients who are able to have the vaccine assessed. As the vaccine trials move to phase 3, a much larger population is being enrolled, consisting of 10,000 participants in the UK and 30,000 participants in the US. A local team in NHS Lothian have recruited 500 participants to this particular trial. Our scientists in Scotland are leading and contributing to this global effort of tackling COVID-19, and we will continue to use their work and other scientific and clinical work to move through the phases of recovery.
Okay, thank you very much, Jason. We'll move now to questions. First question is from Morag Kinneborough from the BBC.
The UK government's reviewing 2-metre distancing. Will Scotland follow suit? Also, your reaction, please, to police intervening in a clash between protesters in Glasgow this afternoon.
On the 2-metre guidance, I said last week, and I'll repeat it again, that we will keep that under review. We will look closely at the case for reducing the 2-metre rule and the circumstances in which that might be appropriate. And if we deem it is safe to reduce that, then we will do so, but we will not do it unless we feel that it is safe in the overall context of our battle against this virus. And my last point on that, which I made last week, is that it is really important, I think, that we don't see any of these particular measures in isolation. The totality of the steps we're taking to try to combat this virus remain important overall, and I think it's vital that we see it in that way. On the second part of your question, as I left my office to come to do this media update, this was an ongoing incident, so I don't yet have all the facts. I will be updated over the course of the afternoon. It is, of course, for the police to ensure that the law is respected and order is maintained, and I have every confidence in Police Scotland to do that. I suppose I would say this in a more general sense. I am a fundamental believer in the importance in a democracy of peaceful protest. I have taken part in many peaceful protests over my life, and it is a fundamental right in any democracy. That said, right now, people, in my view, should not be taking part in mass gatherings because it is not safe. It puts health at risk and potentially puts life at risk given the threat we face from the coronavirus. And it potentially undermines all of the hard work that our NHS workers have done and the population as a whole have done over the past 3 months. And of course, it puts additional pressure on the police at a time when the police have many challenges to deal with. So that would be my first point. My second point is that violent protest is never acceptable. And I should say before going on to this, that in terms of mass protest generally, I welcomed the decision of Black Lives Matter to cancel a planned protest in Glasgow today. But violent protest is not acceptable, and I'd say to anybody who has found themselves today on the streets of Glasgow in an altercation with other groups or in an altercation with the police, that they should really take a long, hard look at themselves. That is not acceptable behaviour at any time, but at this time of crisis that the country faces, I think it is particularly shameful behaviour. So I would appeal to people across the country right now to remember the priority that all of us must attach to continuing to combat and to tackle this virus. Kieran Jenkins from Channel 4.
First, is it just on my screen that you've disappeared, or
I have no idea because I can't see your screen.
Can anyone else chip in? Can everyone else see the First Minister, or is it just me?
We've lost the video.
I've lost it. We've lost the video to the First Minister, I think.
I can still hear you, and if you can still hear me, I'm not sure what's happened to the video, whether that's just on your screen or whether it's a more of a broadcasting issue.
I think if we can't see you on this feed, we're not going to be able to see you on the recording, and therefore...
Well, I tell you what, can I make a suggestion that I go on to newspaper questions for whom the video is not as important, and then we can try to resolve the issue and come back to broadcasters shortly, if that's okay. In that case, I will go to Michael Blackley at the Daily Mail.
Hello, good afternoon. Just to return to your comments on the social distancing rule, can you confirm when that is being reviewed, will you be seeking new scientific advice or simply looking at your own interpretation of scientific advice? And do you still believe that it is the case that Scotland is behind the curve on infection rates?
We will take account of all relevant information as we do on all of these issues. Our number now looks as if it is slightly lower than it is in other parts of the UK. Our numbers are estimates within a range, but it looks as if we might now be lower, and we are seeing cases and deaths decline rapidly. The lesson I take from that is that our careful, cautious plan is working, and therefore we should stick with it, not seek to throw it away and do something different. So that's what I'm saying to people. Let's continue down this careful, well thought out, cautious path, and if we do that, we will continue to see the progress. And I come back to a key point, I suppose, about trade-offs here. The more we can suppress this virus right now, the greater normality that we can have as we come out of lockdown, and perhaps some of the debates we're having right now about 2 metres versus 1 metre, or about travel restrictions, all of that becomes less problematic because we have suppressed the virus so much that we can introduce greater normality to our everyday lives. Christine Lavelle from The Sun.
Thank you, First Minister. Larry Flanagan from the EIS Union has called for more money for councils to facilitate emergency classrooms and to allow schools to employ extra staff to maintain, to maximise the amount of time that pupils can spend in the school environment after the summer. He says the level of enthusiasm and commitment that should be put into this should be on the same scale as the building of the NHS Louisa Jordan. What extra support is the Scottish Government providing to schools and councils to help them cope with the challenges ahead?
Well, firstly, I agree that the attention and focus and commitment that we apply over this next period to ensuring that our young people get the education they deserve, and that we make whatever arrangements are necessary to facilitate that is absolutely required to be on the scale of some of our planning around the health impacts, and it will be. The process we're going through right now, local authorities are making plans and putting plans in place for the blended model of learning that we will see from August the 11th onwards. The Scottish Government will then look at that, and we will make judgments about what additional support is going to be necessary. necessary. We want children, obviously, to be able to return safely to schools, and that is the priority. But I want to see children have as much normality in their schooling as quickly as possible. Now, it will not be possible from the 11th of August to have schools operating as they did before coronavirus, but we must get as much normality, and we must ensure that where children are not in school all of the time, they are supported in home learning, and that's where some of the investments we've already announced around digital learning are so important. So this will be ongoing work over the next few weeks and well in advance of the return to school on the 11th of August. Daniel Sanderson from the Daily Telegraph.
Thank you very much. Just on the same issue of schools, early in the pandemic, when the Louisa Jordan was built, the Scottish Government didn't wait for health boards to put in place their own plans. They took decisive action and spent tens of millions of pounds on building that facility. So why aren't things like temporary classrooms in playgrounds being built right now, given we know that some kids will be back for just one full day a week from August? And also to Professor Leach, could we please get an update on what the science is telling you with regards to the risks of children returning to schools? In some countries in Europe, kids have gone back, in Denmark, Austria and Germany, and it doesn't seem to have led to a big spike in cases there. So what's the latest thinking on that? Thank you.
We'll continue to support local authorities to do what is required. I think it is right, given that statutory responsibility for education lies with local authorities, that they look at the plans that they want to put in place, but the Scottish Government will provide whatever support we need. The principles, I think, are the same in terms of comparing education with health, that we must be prepared to do extraordinary things to support people through extraordinary times, and that those principles will be very much the same. Obviously, the practical considerations and the practical issues we face are not exactly the same between building a one-off temporary hospital and making sure that we have education provision as it needs to be in every part of the country. But the principle of making sure that children get the education they need and deserve is one that is at the heart of everything that we will take forward with councils in the weeks to come. Jason.
We know some things, and unfortunately we don't know others. It's been true of this virus for the 5 months it's existed. We know that children don't tend to get severe illness. We know that children don't appear to pass it on quite as easily as adults, perhaps because they are not as sick and not as symptomatic. But we also know that it is not impossible for them to pass it on, and it is not impossible for them to catch the virus. So therefore, children probably should be treated slightly differently from other groups, but so should the very elderly. So it's a path through the different age groups. Very few children have died of this disease globally, but there have been some, and there have been some that have got very, very sick. So we follow that science very carefully around the world. Even today, I didn't see the detail, but today Beijing closed its schools. It closed its schools because it has a new outbreak of 45 cases in a market. So we have to be very, very careful not to put those children at risk, and that's why an indicative date appears to the clinical advisors to be important, and we will continue to give advice over the summer about whether that's possible.
Okay, thank you. I'm going to now hop back to the broadcaster because I am being given an indication that the video problems we had have been resolved, so let's see if that's the case. Kieran, do you want to ask your question now?
Yes, good to see you again. We've seen a leaked letter that shows that on May the 22nd, the Directors of Public Health in Scotland wrote to the Chief Medical Officer with a whole series of concerns about the new Scottish Government policy to routinely test care home staff, concerns around the science, resources, and a lack of discussion. And these are extremely senior people who would be implementing this major new policy, and they were clearly not on board. Should the government and public health leaders be falling out and pulling in different directions during a public health crisis?
If it's the letter, I assume it is, Kieran. I know that the Chief Medical Officer has replied to that letter, so that would be my first point. My second point would be I wouldn't characterise it the way you just have about falling out. There will be different clinical and scientific opinions about all aspects of handling this. And actually a point I've made before, which I think what you referred to there may underline, is that not everybody in the clinical community thinks that testing particularly asymptomatic people is the right thing to do. Obviously, we've been under pressure, I think, rightly and understandably, to do more of that, and we are doing more of that. But I think what you have quoted there just reminds us that these things are not always clear-cut in terms of the views that the clinical and scientific people will take around these things. But we've got to come to the best view of the way forward, which is what we've tried to do. On the issue of resources, the Health Secretary has ongoing discussions with health boards about the resources that require to be in place. She will always respond if there are concerns about resources, whether it's on testing or any other issue. And as a previous question has just indicated, we have been at pains to make sure that the health service has whatever resources it needs to tackle this crisis and to tackle any particular aspect of it. But I'll hand to Jason, maybe, who will say a little bit more just about the diversity of views in the clinical community over testing.
Well, first of all, let me describe the engagement with that group. And you're right, that group of very senior public health officials and clinicians across our country has been crucial to this response at every step. They are the leaders of Test and Protect. They are the leaders of some of this work we've done in our care homes, and they are leaders of the health protection teams, which have, since the beginning of this crisis, stepped up and helped us. So I do not underestimate their role and their help, and I'm very, very grateful for it. We speak to that group often. So Gregor, the Chief Medical Officer, has regular meetings with them. The Deputy Chief Medical Officer, one of Gregor's deputies, meets them. And there is, I think, even a daily huddle now with some of them about sharing advice in each direction, hearing from them, and also sharing our views with them. There is a diversity of view about this virus. This virus is, again, 5 months old. We don't know everything about it. And some of the things we're doing are piloting things to see if they will help us on this journey. So one individual can't hold the truth. It is simply impossible. So we have to take a diversity of views. And I've talked about the pyramid of science from this podium before. We take lots of views, and then we have to make judgments up to the Cabinet and the First Minister, who then decide what to do with that science, which we filter to get to them. And that, I think, is exactly how it should be. And Gregor replied on the 3rd of June, thanking that group for their contribution, and we took a view.
I think it actually indicates a point I've made here all along about how we have to carefully consider some of these things. Many of the questions we get at these updates, and this is perfectly legitimate, are about why we haven't gone further and faster on testing. But that question, of course, is putting the opposite view. Why have we gone perhaps too far and faster than some public health experts would want us to do? And what that says is that there is a diversity of view, and my job and the Health Secretary's job is to weigh up all of that advice and evidence and come to what we consider to be the best way of proceeding, which is what we've tried to do on this, and it's what we'll try to do on all aspects of handling this particular challenge. Ryan Marr from SCV News.
Thank you, First Minister. We've heard that schools are unlikely to return to normal in the next academic year with a continuation of the blended learning model. How long can we expect this model of learning to last, and in what ways do you expect this will affect particularly vulnerable children, children with specific learning requirements, and as we continue through each phase, parents who may not be able to work from home?
Well, I think it's really important here that while we continue to be cautious in our assessments, because to do anything other than that risks giving people a misleading picture of what the future might look like. So we've got to do that. Just as when we regrettably had to close schools, we were very clear that we couldn't guarantee that they would open again before the summer break, and that has turned out to be the case. We're being cautious now about the length of time that some kind of blended model may be required for. But on the other hand, we shouldn't get to a point where we are accepting now that for a certain period of time schooling will not be normal. I want to get young people not just back to school but back to normal schooling as quickly as it is deemed safe to do that. So we will be working hard to do that, and I hope it is the case that over the next academic year we do see schools returning to normal, but it's not possible right now for us at this vantage point to give dates and say that with certainty. But I want to assure parents, young people, teachers that we will be doing everything we can to make sure that young people have as normal a school experience as possible, as quickly as possible. And my final point here would be a point I made earlier on, is that the more, and this may involve a bit more caution in the short term, to really suppress this virus as far as we can. And if we succeed in doing that, which we are right now, the prize for that in the medium to longer term is that we get more normality back into our lives as we start to ease these restrictions. And I hope for that greater normality in all aspects of our life, but there's no way I hope for it more than in our education system. So we'll be working really hard to get to that point as quickly as it is deemed safe to do so. Craig Payton from PA.
Thank you, First Minister. We've been hearing a lot about the economic toll of coronavirus on Scotland. I was wondering if the Scottish Government has done any modelling on what the deficit could be after the pandemic, what you believe it could be, and anything you've done or are planning on doing to mitigate that. Also, is there a risk that the annual drug death statistics that come out from the NRS could be delayed because of coronavirus, and how will that impact the Scottish Government's response to the drug death crisis?
Well, the drug death crisis remains, notwithstanding the coronavirus epidemic, as a key priority. I'm certainly going to check what the current thinking is around whether there's going to be any impact on the publication of those statistics, but we would want those statistics to be published as close to on track as possible for obvious reasons. In terms of the first part of your question, the Office of the Chief Economist publishes regular analysis and did so just a matter of days ago about the impact on the economy. Later this week we will see some further evidence around the labour market and GDP. Of course, in terms of deficit, it is the UK government that is borrowing right now to fund some of the key economic interventions that have been made, because the Scottish Government's borrowing powers are very limited. So fiscal impact on debt and deficit, which obviously are two different things, are a UK government issue. And my view is that unlike the period after the financial crash in 2008, the UK government must not take an austerity approach to dealing with that. Instead, we should see accumulated debt from trying to tackle the impact of coronavirus in the same way as countries in the past have dealt with wartime debt, something that has to be managed over a longer period so that the impact of that isn't felt in terms of and in the shape of austerity economics. But we will continue to do everything we can in Scotland within our powers and resources to mitigate the economic impact of this. The first part of that is to try to get the economy opened up as quickly and as safely as possible so that businesses can start to operate. But we have already recognised and will continue to recognise that there is a need for further interventions to mitigate and support the economy as it gets back to normal. We will, over the next week or so, receive a report from the Economic Recovery Group, which Benny Higgins has been chairing for us, which will also give us some recommendations to ponder for the next period. And lastly, we'll continue to work with the UK Government to make the case for example, as I was talking about on Friday, a continuation beyond October of the job retention scheme, so that we're not either forcing businesses back before it is safe or forcing redundancies and worker layoffs that can be avoided. So all of these discussions are important, and we'll continue to progress them all. If I can go back to the list of print journalists now, Chris Green from the Eye is next.
Good afternoon, First Minister. Thank you very much. I just wondered, it's now been obviously over 2 weeks since the lockdown restrictions were relaxed. I just wondered if you had any specific data, perhaps even just from the last few days, over whether it's had an impact on the transmission of the virus. Because your comments today obviously suggest it's been minimal, if there has been. And also, just if you don't mind me asking, have you managed to catch up with your own family in person yet? And if so, what was that reunion like?
On the first part of your question, the most important part of your question, not mum, the second part is not important. I'll come on to that shortly. The data we have is the data we publish. every day. So that is the data on case numbers, on hospital admissions, on ICU admissions, and on the number of people sadly losing their lives, and the data we publish, or the estimates rather, we publish on the R number. The most recent one of those was published last Thursday. So at the moment, all of that data is going in the right direction. So we do not yet see a negative impact from the changes that were made 2 weeks ago. But, and here's my injection of caution around this, that we always know that it is perhaps 2, 3, 4 weeks before we absolutely know whether there has been an impact or not. So I wouldn't say that we're at the stage yet where we can say categorically there has been no impact. So the assessments we will do leading up to Thursday will be very important, continuing to take account of that daily information. And on the other part of your question, I haven't yet had a chance to catch up with my family, principally due to just the pressures of work haven't given me the opportunity to do that. That said, assuming it doesn't rain later on today, I may this evening go to visit my mum and dad in their garden, socially distanced, as long as the rain doesn't start. So my mum is probably watching right now, which means I will not get the chance to wriggle off that particular commitment. Alistair Grant from The Herald.
Hi there, thanks very much. Just to go back to the issue of schools and John Swinney's comments this morning that it's unlikely that they'll return to normal before the end of the school year. I appreciate the government is being cautious and things are not set in stone, but should parents prepare for part-time home learning to continue until potentially next summer, given this is something they'll obviously have to plan for given work and perhaps other family commitments?
So this is where we're trying to be as open as with people as we can, and part of that involves just being open about the uncertainties. What John was doing earlier on is what I've done today, which is saying we have to be frank with people that we don't yet have complete certainty about what the next few months will look like. So we can't rule out some continued change to the model of education that young people will be following at this stage over the course of the next academic year. But what I have gone on to say today is that we will want to get that back to normal as quickly as possible. So we will keep looking at the data, we will keep assessing what is happening with the virus, and we will get as much normality back into children's schooling as quickly as we possibly can. None of us want to see this disruption, first and foremost, to children's education for any longer than is necessary, but obviously none of us want to see the knock-on disruption to parents' working lives and their ability to manage work and childcare. So these are all really difficult issues to be absolutely certain about right now, which is why sometimes I suppose we err on the side of the worst case scenario. We are doing everything we can right now to avoid having a second wave of this virus come the autumn winter, but none of us can rule that out right now. So we have to go through this step by step, and the central point I've made already several times today is the more we can suppress it now, the more chance we have of getting greater normality back when we do start to ease all of these things. So that's a plea for people now. The one thing we can influence right now is how we deal with this virus in the immediate sense, and we're all collectively hitting it on the head and hammering it down to a low level. If we can just keep doing that to get to the point where it is almost eradicated, then that gives us much more ability to move into greater normality in the medium term than we will have if it keeps sort of lurking around at quite dangerous levels. Paris Gurtisanis from The Scotsman.
Thank you, First Minister. This week in the Scottish Parliament, Fergus Ewing said that if progress continues in suppressing the virus, the tourism industry might be able to begin reopening as early as the 15th of July. If that does prove to be the case, would that include overnight stays, those being permitted, and would it also mean that the border could reopen for tourists to travel into Scotland from the rest of the UK and travel onwards?
So there are a number of different issues involved here, and we have to assess them all and take them all step by step. And the first one, I would certainly hope that we could see the position that by the middle of July we have people able to go on, vacations within Scotland, staycations and stay places, but we need to, and we very much want that 15th of July date to be a real one that we can meet. But of course we have to assess things between now and then, which is why we were very clear, Fergus was very clear, it remains conditional at this stage. But I know how important it is to our tourist and hospitality sector that we get them reopening and operating as quickly as possible. On the issue of borders, the regulations that are in place now will be reviewed on a regular cycle, and again we will make judgments about that dependent on the data and the science and the evidence that we're seeing at that time. Everything that we're talking about here, whether it's education, the economy, or any aspect of the economy, we want to get back to normal as quickly as possible, and we want to get as much normality restored as quickly as possible. But that all depends on us continuing to suppress this virus. I am very, very aware that as we see these numbers go down, the human instinct, I guess, is to maybe forget, unless, of course, you're somebody who has had this virus or been bereaved by this virus. For the rest of us, perhaps, it's easy to forget just how dangerous it is as we see these numbers go in the right direction. But we can't forget that. We have learned to our cost, and some families have learned to their loss over the past few months, that this is a virus that can take people's lives. And some of the emerging evidence about it is that even those who survive the virus may be left with some long-term health implications of it. So all of that says that we must continue to be cautious and suppress it. And the more we do that, the more we then can look forward to greater normality in the weeks to come. And the last question today is Adele Merson from the Aberdeen Evening Express.
Good afternoon, First Minister. You have said that you would like to see the furlough scheme extended. Chancellor Rishi Sunak today said he felt like he would have been generous to provide 8 months of support until the autumn and that it might not be sustainable to keep doing so. Are you concerned that his comments could suggest no further extension to the scheme?
If those comments suggest that there is a closed door to further extension of the scheme, I would be very concerned about that. I hope that's not what the comments mean. I think the Chancellor has brought forward very, very welcome interventions thus far, and I hope that there is a continued willingness to look at extension of some of those interventions. And I'm absolutely mindful of the financial burden of something like the job retention scheme. But of course, withdrawing that doesn't necessarily take away any financial burden. It simply transfers it if we see lots of people then avoidably made redundant. So this is about trying to protect jobs and protect the productive capacity of our economy. And we see other countries, France being one of the main ones, already indicating that they would be prepared to continue schemes like this for perhaps up to 2 years if it was necessary. So we'll continue to seek constructive discussions with the UK Government about this so that we don't see the premature withdrawal of schemes that would then, as I said earlier on, either force businesses back to work before the evidence says it was safe, or force employers to make people redundant when that could be avoided. And I hope that we get a good outcome from these discussions as we have in the past few months so far. That concludes the questions we've got today. My thanks to journalists. Apologies for the technical problem we appear to have earlier on, and my thanks to those who were able to resolve that. Thanks to Fiona and Jason for joining me today, and to Anna, our BSL interpreter, for helping to make this briefing accessible to everyone, and thanks to you for joining us. Please continue to stick with the rules. As you hear today, we are making so much progress, and the more we suppress this virus, then the sooner it will be that we're talking about getting back to normal, and the greater degree of normality we'll be able to look forward to. So thank you for everything you're doing. I'll be back here with you tomorrow at 12:30, the normal time for weekday briefings. Thank you very much indeed.